dark as well, unable to track whether an encounter had resulted in a RAP, and assist a provider in outreaching to providers about what may be causing that problem and resolving it on that side. And then we are making changes to Kentucky Health Net so that providers can pull a report to show, and we're gonna, at the work group this afternoon, we're gonna have a little more discussion and presentation on it, but they'll be able to see both, I believe, both what's been on threshold and what has generated an error that's not created a RAP. So again, I think I probably not moving as quickly as some would prefer, but I think moving in the right direction is always good. So we'll just continue to work on that. I think, again, creating the allowing for the current process to work appropriately and identifying what claims aren't generating a RAP is in everybody's best interest, and will help us ensure future correct RAP payments.
At that time you talked about that last meeting, you were talking about from the provider side, that information around the RAP being on the Kentucky Health Net so that the providers be able to pull the reports off through Kentucky Health Net. Are we there yet?
Well, the system is being configured. That's probably the biggest challenge we always have, is taking our very antiquated system and making changes to it. So those changes are being made, and the update this afternoon, I think it will give us a better understanding of where things are with that, and when providers can expect the ability to do that. And again, what does that mean? What kind of information will be coming to the providers?
Okay.
Veronica, this is Chris.
Yeah.
So will there be some sort of notification to the providers about that access into Kentucky Health Net and where to find those reports, and, as you said, exactly what will be available for them?
Yes, absolutely, Chris. And not only that, we're gonna prepare either a PowerPoint or some type of document that can walk providers through the necessary steps.
Thank you.
Yeah, absolutely.
You also talked about the MCO pharmacy benefit manager implementation, and it actually was implemented at midnight the night before we met. So we're 2 months down the road. At that time, it seemed to be going well. Is it continue to go well?
I believe so. I think with any PBM, we've had some of the normal, whether something's being covered or how does the pharmacy put in an override. I will share that I think probably the two biggest hiccups have been the change in the payment schedule for pharmacies. And so we took that in and decided to move from a 14-day payment cycle to a 7-day, which I think a lot of the pharmacies were used to pre-single PBM. So we made that change to make that a little easier on them. The other thing was lock-in. There was some confusion over lock-in. We've had lock-in and lock-in means the member is locked into a particular prescriber and or pharmacy. We've had that program for I probably almost as long as the program Medicaid's been in existence. But for some reason, when we made that change, some of the updates or perhaps what we think maybe happened is maybe the MCOs weren't implementing lock-in as the department felt like it needed to be implemented. But anyway, we worked through those challenges. The MCOs retained override authority on lock-in because they're the ones that determine based on a set criteria who gets locked in. But what we want to make sure is people get their medication. So we had a couple of things we had to work through on that. And then the last one is on coordination of benefits and third-party liability. There were some issues with the files. And again, to ensure that people got the medications they needed, we relaxed some of the edits around that, but those claims will be reprocessed to the appropriate third-party liability. So, otherwise, just I think a couple of things here and there where, members identified some challenges, and I have to give credit to MedImpact. They were on top of them, working with pharmacies, working with providers to make sure that members get their drugs.
Okay. You and I have corresponded a couple of times about perhaps the DMS preparing a flow chart outlining the RAP payment process from your all standpoint. Have I missed that, or is that something still in the works?
I'll have to go back and check that. I thought we did provide it very complicated. If you recall the last work group, there sort of was a very complicated process flow, but let me double check that was going to meet your needs, and see if there was something else that was out there.
My apology. I missed the last one, so I did not see what it was. I do know from the minutes that y'all had a very good discussion, and that Yvonne gave a process. But I've not seen anything come out of actually what that looks like.
Well, if it's okay, let me send that to you, and let me know if that's what you were looking for, and if not, we'll certainly take that back and see what we can do.
Absolutely.
Okay.
Absolutely.
Hey, Veronica, this is Barry.
Yes.
Hey, we have noticed a major influx of prior authorizations by the new PBM. Is there any thoughts of maybe looking at that and being able to scale some of those back? It's inundating our nurses and stuff getting these PAs out.
So if I understand your question correctly, is that you're seeing an increase in PA required from the MedImpact?
We are.
Okay.
Are the other clinics? Are you Mike?
Yeah, a couple of things just to note about that. One is we went to the single preferred drug list on January 1. And so as of that date, we were supposed to be fee for service, and MCOs were supposed to be aligned about what drugs are preferred. And if not on the preferred drug list, then it required a PA to override. What we discovered on July 1st, and honestly, probably about 30 days. So at some point in August, we discovered that there might not have been consistency in how that single PDL was implemented across the MCOs and in alignment with fee for service. So we are, as a result of that, if there was a drug that previously the MCO didn't require a PA for, but is appropriate for PA because it's implementing the single PDL as required. That's caused some issues. Now we have been working with MedImpact because we are trying to reduce both the burden to the prescriber and to MedImpact. And so we have been working through smart PA options and override and what of course we're grandfathering through the end of September 29th. But the problem is I know a lot of prescribers are wanting to go ahead and do a prescription for October. And that's also generating additional prior authorizations that will be required because the drug's not going to be no longer grandfathered. So, if you would like to maybe send me some examples, especially if it's on particular drug classes or drugs, happy to take a look at that. because we were concerned with the rush of PAs in this next month, both on MedImpact being able to process those, and of course, as you've noted, on the prescriber side.
Yeah, I mean, I know that they're kind of stressing about the September deadline for a bunch of the PAs where they're expiring, but I think it's just, I guess with the change in the formulary stuff, there's a lot more PAs required. And now with the September deadline, it's going to inundate them with even more. So I guess that's why it's concerning, but I'll give you some examples.
That'd be great. Thank you.
Thank you.
Veronica, someone has made a comment in the chat, and I'm sorry, I think was during the time you were speaking, but I didn't notice it, so I'm not sure. But it said, I noticed the changes, but it stated you needed an ICN. Is that to be the platform?
I'm not sure what is that related to the reconciliation, the RAP reconciliation?
Carla, could you?
Okay.
Yeah, supplemental
Carla.
RAP to providers. Carla, you may want to unmute and give us a little bit more information.
Yeah, I'm just not sure what it means by it stated you needed an ICN.
Looks like she's unmuted.
It stated you needed an-
Carla, I don't think we're able to hear you. Maybe, are you on the phone, Carla? Well, that's not going to help me because I can't hear.
Charlie, she's responded as the supplemental RAP to providers. And I think she asked that question when Veronica said that we would be talking about that in the work group later on today. So not to dismiss it, but I think without getting into too much detail of what they've put into process, we should just wait until our work group meeting this afternoon and discuss that.
Yeah, thank you, Teresa. I also recommend maybe that we probably by the next primary care TAC meeting, the system will be updated and going live. So maybe we could have somebody come and do a short presentation about what that looks like for providers. If that sounds good to you, Mr. Cottle.
Sounds fine to me. All right. Any other questions of Ms. Cecil?
I think the only thing I would just say is that, we need to continue to encourage quality provider education as when anything changes, so that we can keep everybody up to date on the changes. And I think that's in our discussion work group. And I think that is one of the agenda items, to provide quality education back to the providers.
Okay. I believe Ms. Cecil's agreeing with you. I see her nodding there.
Yes.
I agree. And absolutely, if we're not doing a good job of that, or if we need to do something differently, my door's open. I want to hear it. I want to do better. And we're happy to get that feedback.
All right, let's go on to item 4B, new information update on court ruling regarding MCO contracts. Ms. Cecil, last time we met, you told us that the appeals date did not run until July the 14th, and you were not able to say anything since it was pending litigation. Can you give us an update to that now?
It has been appealed, and so it is still pending litigation.
All right. Makes that nice and short. And then we'll go to item C, a discussion regarding return to in-person TAC meetings. Since we last met and discussed all of our plans about doing the hybrid meeting of Zoom and in person, at KPCA. Obviously, the Delta COVID variant has changed everything. So I think that the KPCA and as a practical matter, we need to be holding 100% virtual meetings until things change a little bit. And what's everybody else's thoughts on this?
Mike, this is Yvonne. I would agree that I think until our numbers come back down and that we continue in our virtual meetings to minimize the risk to all.
Yeah, I would agree with that too. Again.
I agree as
safety
well.
first.
Okay.
And I thank you very much.
Do we need to put that in the form of a motion then?
Personally, I don't think so, Mr. Cottle. I think you're fine with just what you've done.
Okay. Charlotte, last time when we were discussing this, you said that the department was looking into buying the necessary equipment to be able to host hybrid meetings, meaning in Zoom and in person at the same time. Has the department been able to do that so that when we do go back, we can schedule at the department?
The last time I checked, which was a couple of weeks ago, I think they had kind of picked out what they wanted, but the purchase had not been made yet. So
Okay.
that'll happen before long. And I realized yesterday, it's kind of hard to believe that we're in September, and really anybody meeting in September is only going to have one more meeting in the rest of this year. So hopefully we should have everything lined up by January 1 to go and do both if a committee wants to do both.
Okay. All right. Thank you.
Mm-hmm.
So any other discussion on anything before I go into new business? All right. On the agenda, next item is 5 new business, and under that the MAC procedures related recommendation of submission and TAC meeting dates. In the, I believe it was May meeting, there was a discussion between Commissioner Lee and the MAC board, particularly Board Chair Parton, about the procedure and the desire of the cabinet to change that. Let's see. The procedure, as I understand it to be, was set out on page 27 of that transcript by Chairperson Parton, and she said, I think the formal process is that the TAC makes a recommendation, they submit it to the MAC, and then the MAC would vote on which recommendations they want to put forth, and then the department would respond to those recommendations. Commissioner Lee was wanting to change that, where she wanted to insert DMS into the first part of that process, where the TAC would make the recommendations to DMS, and DMS would then compile them and send them to the MAC for consideration. And then there was timeframes involved with that. 2 weeks in front of that, and Chairman Parton then said, well, she needed it even earlier to be able to put on her agenda by at least a couple of days. And Commissioner Lee said, well, they would get a response within 30 days. And Charlie pointed out that by the bylaws that the DMS had 45 days in which to respond. And that kind of ended up with Commissioner Lee promising that that they would look into to that and make a formal recommendation for a process. And I've not seen that. And I don't know if anyone else has seen that. So the way it starts backing up, it could cause problems about these meetings and being able to get our recommendations in a timely manner. So I'm wondering if maybe, I don't think I saw Commissioner Lee on here, but if somebody can speak to that through department, that if there's going to be a formal process along those lines that Commissioner Lee discussed, where is that? Has that been prepared yet, or is that just gone by the wayside?
Well, it hasn't gone by the wayside. We are still working on some stuff, and you're right in that, if we back up timelines a lot, that it runs into, any meetings within 2 weeks of the MAC could maybe not be able to get their recommendations in. So we're still looking at what we want to do, but we would certainly, the department is not going to just arbitrarily put out some stuff for the MACs to have to do without working with, not the MACs, I'm sorry, for the TACs to have to do without us working with the TACs. And I've kind of been thinking of trying to, and subject to Commissioner Lee and Deputy Commissioner Cecil's approval of maybe getting all of the TAC chairs together to just try to come up with some uniformity so that all the TACs are like kind of headed in the same direction, and everybody's doing, not that we want you to do the same thing because every TAC is different, but that you just kind of follow the same format and everybody gets the same guidelines going forward. But we're still working on it.
So at this time, then, is the process the same it was before Commissioner Lee brought that up until such time as proposal is on the board then?
Yes, and I think one of the things that Commissioner Lee at that meeting was wanting was to allow DMS to get all the, especially if you had a recommendation, but especially any report that the TACs were going to give to the MAC, that we could get those in enough time to be able to distribute them to the MAC for them to review the recommendations. Now, and all the time that I've been working with the MAC on this and the TACs presenting their recommendation, the MAC has never said, we're not going to accept this recommendation. So really what they do at the end of the TACs meeting, they just make the general, do we make a motion to accept these recommendations? And they always have. Mm-hmm. But some of them, if it's really technical, and we have had a couple of recommendations from a couple of the TACs that have been really detail oriented. So I think what the thought process was of being able to get those to the MAC members at least a couple of days before the meeting so that they could review them and see what the detail was. Because I don't know if y'all are like me, but when I'm sitting somewhere, somebody's reading to me, I comprehend better looking at it and seeing it and making little notes on it so I can think myself a little bit on it. So it would just help, I think, the MAC members to be able to get them all together before the meeting. And that's our ultimate goal.
Mr. Chair, if I could say something.
Yes, go ahead, John.
Okay, John Inman for Kentucky Primary Care Association. Just to kind of add to the discussion, Ms. Cecil and I had a conversation about this, and Veronica, correct me if I'm wrong, but I think if there are any new procedures, it would have to be amended in the bylaws. The bylaws currently lay out the proper procedure for the recommendations and the timelines of that. And were there any changes to be made, then obviously we'd have to make some accommodations to line up the meeting schedules and before those are published next year. But if we don't anticipate making any changes in the bylaws before next year, we think the dates can stand. I mean, doesn't change anything out of courtesy if we want to submit it a few days earlier, but any formal changes need to go through a recommendation to amend the bylaws. Veronica, do you think that's accurate?
Yes, that's correct, John. I think the commissioner's intention was to find if there have been some concerns or challenges with responses to find a better process. But we can continue to work through that. But for now, I think the process is going to stay the same as indicated in the bylaws. And if there's a recommendation to change those, the department would certainly be happy to conform to whatever the MAC decides it wants to do.
I think as a practical matter, if that type of proposed change went through, and maybe it's not that such a big deal or anything, but as a practical matter, we would have to meet in the off month rather than in the same month as the MAC to be able to ensure that we were able to timely present any recommendations we had.
Right, and I think that's been one of the biggest challenges is some of the TACs meet up really close to the MAC meeting, and so the transfer of that information and those recommendations is making it difficult, both I think for the MAC to make sure their agenda and the information provided to the MAC members is timely and gives them the opportunity to review it. So, I think it's a timing issue about some of the TAC meetings being a little too close to the MAC meeting. But again, we're open to suggestions if there's an interest in making changes to the process. Certainly, we would be happy and to listen to those changes.
Yeah, Commissioner Lee has said that they would that the department will develop some written guidance to send out to all the TACs and the MACs. But what you suggested about doing so in a way of getting our feedback in a meaningful time frame, I like even better. All right. Any other comments on that?
So Mike, this is Yvonne. Do we have pending responses that we're waiting on right now?
Do what?
Do we have responses from the MAC that we are currently waiting on?
I don't think so.
Okay,
Have all those responded to?
okay.
If you do, please let me know, or I can go back and check too, but I'm pretty sure that I've responded.
No, I don't think that we have any that I'm aware of at this time. We have one that is, I guess, pending because of the need to provide additional information to the DMS.
That's probably what I'm thinking about. Thank you for clarifying that.
All right.
Yeah, because I was at the last MAC and nothing was pending from our perspective at that point when I reported on behalf of Primary Care.
Okay.
All right, so then we would go to B on the Evolent recruitments and claims, and John Inman will speak to that.
Yeah, John Inman, KBCA again. When I say we, the Primary Care Association through its IPA had received some letters from Evolent, which is Legacy Passport, up until December 31st, 2020, about recoupments for potential overpayments. We understand that there is an appeal process for that. So what we were looking to do is just to get some clarification from Evolent on how that appeal process is going to work, their approval from the department, as well as any outstanding claims that may be owed to our clinics that haven't been paid yet either. So our concern was offsets if there are recoupments or if there are overpayments due, and to get them, if Evolent would speak on their appeal process.
Hi, John. This is Aaron Werner. I am the appropriate, or I'm the team member responsible for leading this project for the Legacy Passport team. I appreciate the opportunity today to speak to all of you, and thank you for inviting me to this call. The appeal process and detail is included in the letters that each one of the facilities have received. There's specific direction on where to address the concerns to. At the same time, we're managing all communication through a DCOM email box that I am personally managing and responding to. Specific to KPCA, I have been in contact with your organization and readily responding to emails. We have a goal in mind of responding to those inquiries in that email box within about 2 business days. And if it does take longer, we will communicate that as well. At the same time, we do welcome conversations with providers such as yourself and your facilities that believe there are still outstanding underpaid issues. We've had a number of conversations with providers that are not KPCA to that effect, and are working with those providers to align on what the dollars are believed to be underpaid and overpaid, and work through those items in various fashion to make sure that you as a provider are aligned with what you believe is underpaid, and at the same time allowing us to have a successful run out and dissolution of our health plan responsibilities in the form of those overpayment and the refunds coming from providers in that fashion as well.
Aaron, this is Yvonne Egan. So I have some follow-up questions and a couple of concerns.
Sure.
And first and foremost, we have not received our letters. And I understand the letters were dated sometime around mid-August, which is obvious, and that the letter states that they're expecting the clinics to respond within 30 days. So obviously we're halfway through the 30-day cycle, and that if these overpayments are not returned or appealed within the 30 days, then a collection will be turned over to collections. So that's my first question, if you could address that, and I have a couple more.
Hi, Ms. Hagan, can you, I'm fairly new to the folks on this call. Can you please clarify for me what organization you're with, please?
The organization that I'm talking about is Family Health Centers in Louisville, Kentucky. And our contract was not through the IPA during the time period that you're asking for the recoup.
Do you have a series of TINs that you're responsible for, or is there one particular TIN?
It's 110, but we do have multiple sites.
This is Veronica. I think maybe what would probably be the best approach is, Aaron, if you don't mind sharing your email address, and then if there are providers that want to reach out to ask specific questions about their situation, maybe do it that way. Perfect.
Thanks, Ms. Cecil.
And that way you can share the NPI or the PIN.
That's exactly where I was going with it. Ms. Egan, just for your awareness, we are doing this project in phases. So that's why I was requesting your TIN to identify where your letter was in this process. I will put my the DCOM email box that I referenced, I will put it in the chat. And if you are able to reach out and just provide me with your TIN, I can certainly review. And we all know that there's issues with standard mail at this time. So I will also be able to provide you with an electronic copy of the letter as well.
Okay. And then I understand the appeals process is a manual process. Depending on what the clinics might be facing in volume of this, a 30-day run rate time on that, it can be pretty tight for the clinics, especially while they're trying to get their clinics back up and running from the pandemic. So I think the 30-day demand is a little short for that request. So I think we should be giving some additional time on that.
I understand. If providers are able to reach out to the mailbox, we are on board and very much willing to work with each individual clinic as needed. And at the same time, during this process, we are following the standard regulations, that we are aware of. And that's where the 30-day window is coming from, to my knowledge. That's been standard across, legacy operations, if I recall correctly.
Yeah, Aaron, it's Veronica. So we have informed MCOs that right now during the public health emergency, they should be, while you should put the 30 days in the letter, because that is in compliance, they should work with providers individually about extending the time if a request is made to extend the time to appeal, and to give providers additional time to that appeal. The department sends out guidance on that.
Totally agree, Ms. Cecil. And that goes to my first point of, when providers are receiving this letter, there's detail on how to reach out and contact us. And like I said before, we're more than willing to work with providers to the degree necessary, and provide whatever data is needed and timelines for your review. And we welcome follow-up inquiries, clarification, as many of the providers that have reached out have requested, and we have followed up in suit and provided that level of detail.
Okay, but do remember, talking with other clinics, I haven't been able to speak to any other clinics that have received these letters. So it's hard to respond if you have not physically received your letter. And so I really question when these letters were mailed, if they were dated around the 17th of August, why these clinics, not just my clinic, but other clinics are not receiving these letters. So I think that really needs to be looked at seriously and some kind of follow-up on that, because you can't respond and ask for an extension if you've never received the initial letter.
In addition to the letters that were sent, Ms. Agan, we've worked with the provider team that is sitting with Molina to obtain contact information for the facilities that we were mailing our first 2 rounds of letters to. We at the same time of sending the letters, we also sent an outreach to, I think it was roughly 100 different providers, with a notification that these were being dropped in the mail, and to reach out with any questions. So we went a few extra steps in sending that email notification as well. But per this call, we understand that there are mail concerns. So again, I'll put the note, the email address in the chat. And please reach out with any questions or concerns that you have. And we certainly can provide the electronic copies of the letters if they did not make their way via standard mail.
And just to add, so keep in mind that maybe you didn't get a letter because they didn't have a recoupment or identified overpayment for that provider. You could always, think positive that didn't happen.
Other clinics, I do know that they did have overpayments, and they have expressed to me as of late yesterday, they still have not received their letters either. The only thing that we have officially received was an email notice sent on August the 10th stating that these letters were going to go out. And that was it. That is the only contact we have had. I've reached out to 2 other clinics, and that is the only contacts they have had. So I think it just needs to be noted that the 30-day time period is running, and there's a possibility that people are not receiving their letters timely. But I would like to go ahead and move on and talk about the unpaid claims. There is a substantial amount of unpaid claims that are still pending out there. And what we have found is that we have tried to reach out through the normal portal, and the portal, the passwords have been turned off. And when it says reset your password, so you go in, the claims people are trying to reset their passwords, and it says we're going to send it to an email. The email never shows up. We have called provider services. If you can get through after waiting on hold for 45 to 60 minutes, they tell you they can't see any of the legacy claims, they cannot help you, and that you need to talk with the legacy claims representative, for which they may transfer you, and then you transfer to the legacy claims person who tells you they can't help you, that you need to call your provider rep. So you call your provider rep, and you may or may not even get a return call. So we are sitting there, we have been trying to work these unresolved claims for quite some time, and it's not been a successful venture at all. So I do have issues about making sure that this line is, I hear you talk about needing to close and disillusion and close your books down, and I get a little concerned that we're not putting the same emphasis or the easeability to get these outstanding claims resolved, and that we're pushing forward on getting the overpayments, which I would agree to. If you are do overpayments, that needs to be resolved, but also these other claims, and we need a little bit more accountability to help the providers get these things resolved.
The underpaid issues that you're bringing up today, Ms. Agan, are they for dates of service prior to 2021?
Of course, yes.
Okay, just
It's within the same time frame that you are requesting the overpayment.
okay, just clarifying. Thank you.
Hey, Aaron, it's Nicole Basham. Hello, Ms. Agan, Nicole Basham, Vice President at Molina. Aaron, if you will share with me her 10, then I will have the team take a look at those claims on our side and work with you and your team, Aaron, to see if we can't get her some answers.
Can you,
Perfect.
we reached out to our provider rep probably 4 times now to talk about the shutdown and the password problems. And we've asked, you know, have these systems been shut down and they've been disabled? And we don't have an answer to that. Can you answer whether they have?
Yeah, how about you and I take it offline and we can talk through all your questions and concerns and let me get you the answers. The systems are still up and running. Some folks just have a little more difficulty with access. Obviously, Evelyn's still processing claims, both over and under payments. And then anything new that would be coming in the door that's just kind of left over from cleanup. So we will get you some answers. That's my commitment to you. And I will set up a call to talk to you offline so we can walk through your concerns.
So I asked the other committee members, are any of the other clinics experiencing similar problems?
Yvonne, this is Chris. Excuse me, I was going to ask the committee, you know, I do apologize with my retirement. I don't think I'm quite up to date on this issue. Can you, my committee people, kind of give me, are these medical claims prior to passport changing or dissolving, and then now they're Molina? And then how far back does this go? Because all I can think about is, obviously, whenever there's a recoupment, then that means we play the domino game with the PPS rate and our RAP payment again. So can you just quickly give me some information on that for me?
Chris, would you, do you all want me to answer, Chris? I'm sorry. I'm not sure who the question.
Yeah, passport healthcare by Molina is a small part of what we do, and I don't believe that we've even received the letter that Aaron referenced earlier. If so, it's not been brought to my attention.
So Chris, what is happening is that Avalon, legacy passport is what I understand, and Aaron, you can please correct me if I'm wrong. They're attempting to close down that time period which they processed claims, which was October 1st, 2017 through 12/31 of 2020. And they're asking that the clinics resolve any overpayments and send them a check for those. Simultaneously, we are still having, it has become very burdensome and difficult to even try to work with Passport on any claims that resolved in this time period. And I too have the same issue. If we're going to get into recoupments and the spin down of all that into our wrap. These letters were supposed to be sent to ask for the overpayments to be mailed back to Passport, but there has never been any issues talking about how to deal with unresolved claims.
Can you tell me, Yvonne, as far as what's the basis for the overpayment? I mean, was it they paid an MD schedule as opposed to an MP schedule, or what's the basis?
I can't answer that because I haven't received my letter. To my knowledge, when we know of an overpayment, we report that, and it is recouped off one of the future payments. So I don't have any idea what these claim to be overpayments are or what the claims look like because I haven't been given that data yet.
Okay,
Mr.
thank
Chair,
you.
can I ask it? Hey, Aaron, if you don't mind, just for everyone's, because I know, having received them on the KPCA side, that what's in the letters, but do you mind, from as the representative of Evolent, just to let the committee know what is included in the letter, not just a letter, and we've already discussed the appeal process, but the other detail that's in the letter, please?
Sure, happy to. So the detail in the letter, as we talked about before, has check information on where to mail a refund check to if you agree. In addition to that, it's clearly articulating that this detail is not related to Passport by Molina, and it's all dates of service pre-2021. There's the inquiry mailbox that is communicated to you all, along with appeal rights, as we talked about before. And then lastly, there is claim level information, such as claim number, date of service, member name, ID, provider NPI, the dollar in which we've identified as overpaid, and the reason for overpayment. Each individual provider and facility may experience different reasons for overpayment. It could be related to eligibility. It could be related to various audits and post-pay audits that our teams run, in addition to configuration errors that we've identified over the course of business. All of this data and all of the claims that we are lettering to providers has been QA'd. Lastly, one of the main points that we followed was assuring that these claims that we are requesting overpayment for were all adjudicated within the last 24 months, meaning that we did not look and we actually did not letter a good amount of claims because they were outside of the 24-month time frame in which we have the ability to work with providers on recouping. So I hope that is helpful.
Yes, thank you. And so I guess my question to DMS then is, what happens with the reconciliation for all the RAP payments that would be associated to this claim? Is Legacy Passport or Evolent, do they send DMS information on all the claims recoupment, so then we can expect to get some sort of communication from DMS that discusses how to shore up or what's going to happen with recoupments or payments for RAP payments?
This is Veronica. So despite the fact that Evelyn is trying to close their books, there's still a responsibility for continuing the process that we have already established when it comes to encounters, claims, encounters, and RAP payments. So that should not change. I will add that, and Aaron, please make sure that you put the email box that providers need to reach out to confirm whether they have an outstanding payment or an overpayment. I am concerned about ensuring that Evolent not only is recouping, but also paying if there are claims that are pending. So we just need to make sure that we're doing both sides of that process. You know, again, if providers are having challenges with any of that, we want to know about it so that we can make sure that it's being handled properly.
Certainly, Ms. Cecil. I just put in the email address, and I will just say it out loud for everyone in case you're not looking at the chat, but the email address is passportdcom, spelled DCOM, @evolenthealth.com. Again, it's in the chat for all of you, and I'm sure it will be accounted for in the notes as well. I can certainly send it if Ms. Cecil, if it's to you or somebody else, I can send an email there just so you have it as well. As Noel had said before, him and I have been conversing back and forth via that email thread. And at the same time, regarding the underpayments, we are still focused on processing any new day claims that we receive correctly through our runout. And then in addition to, we're continuously working via various avenues to resolve any provider issues. We have a ticketing system that we constantly are monitoring to assure that claims are being processed, or provider concerns are being processed appropriately. And at the same time, there is the call center opportunity as well. If it's a 1 claim or 2 claim issue, that you can call in and potentially get resolved that way as well. If there's a need for configuration or any type of clarification, again, we're my organization, along with now the folks on the Molina end, are constantly meeting once a week, and also to just working through items as they surface based on priorities provided, and working to resolve all all open concerns and issues.
I will say one last thing, Mike, if that's all right. Just to Aaron's credit, I have been communicating with him, and I know he said that they have a goal to respond to those emails. I will say that he has been very responsive to me in those emails. So, you know, to any provider that's on the call in the committee, if you all are using that email, yeah, I just want to give credit to Aaron and that he is responding to those emails in a timely fashion. So, you know, just wanted to say that.
Thanks, Noel. I appreciate that.
Okay, Aaron told us the email, and he also put it on the chat here, so you have it in writing. And as my understanding, he's going to be sending out something further along those lines, and that Nicole and potentially Aaron will be talking to Yvonne directly about her particular problem, and Noel, KPCA, will be monitoring this situation to keep its members advised on any it may affect. Is that a fair summation here?
It is. I have one other question. When we go through this process, Aaron and Passport, because I'm not sure where the liability is in this equation, are we to assume then that that our whole process with Evelyn is shutting down? Will be shut down, or will this legacy continue to be open for the 2-year corrected claim time period?
This is Aaron again, Ms. Hagan. It will be open for the 2-year rundown time period.
Okay.
For overpayments, I suggest using for overpayments, I suggest using the Passport DCOM email box. If there are underpayment concerns, my team, along with the provider relations teams that you are in contact with, are constantly collaborating to resolve those open issues as well.
Melanie,
Thank you, Aaron. Yes, this is Melanie Claypool. I'm the director of the Provider Services Department. And Yvonne, I will be working with Nicole as well for the provider services standpoint.
Okay,
We apologize that you haven't gotten the response, but you definitely will be getting responses.
thank you.
okay. Yvonne, do you have anything else you want to add?
Thank you for your patience and
Well, it's an important issue.
Hey,
Okay, then.
Chair Cottle. This is
Barry?
Barry. I think the only problems we're having right now is with Humana. And I know that Sheila's working with KPCA. We're having code issues on their side.
I can say that we too are also having Humana problems, but I wasn't prepared to talk about it.
All right.
You're just trying to put out the biggest fire, Yvonne.
Yes.
Let's go to 5C, the updated announcements from the MCOs. And Jennifer, if you're on here, we'll start out with Anthem.
Yes, hi everybody. This is Jennifer with Anthem. Just a couple announcements. We are launching a smoking cessation provider incentive program. There will be a bulletin to reference for additional details, and it'll be located on our website. And this is to encourage providers to provide smoking cessation counseling to members who use tobacco, including referring them to the Kentucky Tobacco Quit line. Another item is Anthem is hosting a Lunch and Learn webinar for providers concerning diabetes management. So that is going to be held on 2 different dates, October 26th and November 9th. So providers and healthcare professionals will be awarded 1 CME and CEU credit hour for attending. Registration is going to be required, but the educational invite is also going to be available on our website here soon. And that is all I have today.
Okay, thank you, Jennifer. Johnny, I see you're on here. Johnny Akers for WellCare.
Can you hear me okay, Mike?
I can.
All right. Thank you, sir. Just wanted to give a brief update on some of the initiatives that WellCare has been involved with regarding vaccinations. So we are offering right now through December of this year, and that could be extended, but we're offering a $100 gift card to any of our Medicaid members who will obtain their COVID vaccinations. We have provided information to all of our members on how to redeem that. It's really simple. So just wanted to share that with you. And if anyone needs the information that we have shared, we've published it on the website. We've sent it to all of our members. But if you need that flyer, just let me know, and I'm happy to share that. Some of the other initiatives that we've been involved in, and I'm not going to read the whole list, but just share some of the things that we've been doing. We are involved with Kentucky Sports Radio, Shots Across the Bluegrass events. We are outreaching to our at-risk members. So far, I think about 95,000 of those at-risk members we've outreached to regarding vaccinations. Of course, we participated at the state fair with the Kentucky Association of Health Plans. We've partnered with the Pro Football Hall of Fame. We are partnering with them on increasing education and awareness about vaccinations through public service announcements. And we're planning, and these dates and locations will be published, WellCare Harvest Festivals, where we're going to be engaged regarding vaccinations, dental checkups, wellness events, and those sorts of things. So a lot of outreaches that we're doing. And again, first and foremost, please help us share the word that if you have any WellCare Medicaid members and they need to get their vaccinations, we are offering a $100 gift card to them. And that's all I wanted to share today. Thank you.
Okay, I know that, and we'll get down a little bit later, but Melina was offering something last time. I believe Mr. Hewlin had talked about that. And it'd probably be good in our instance, we started this week a drive-through off-site for vaccinations on first, second, and if eligible, the booster shot. And through last night, we'd done somewhere approximately about 450 of those. And it certainly would be an added benefit to be able to give information out to the people taking the shot. So if there is an incentive there, they certainly should be able to capitalize on it.
Yeah, and Mike, I can, I'll email this flyer. Noel, I shared that, I think, with you and the folks at KPCA. And Mike, I'll email this up to Teresa, and so you guys can have that available when you do your initiative.
I saw right off the bat that you decided to send it directly to the person knows what's going on rather than the man in charge. So I commend you.
And I'm happy to share that with you too. But yeah, I'll shoot that up to her, and yeah, appreciate the partnership.
Okay, thank you.
Thanks.
Sammy, I believe you're on here. Do you want to speak for Aetna?
Hey, good afternoon. This is Joanne. Can you hear me?
Yes, Joanne, I can. Will you be speaking for Aetna then?
I am. Sammy had to drop for another meeting. I'm so sorry. I'm Joanne Rose Marston for Aetna. So we as well wanted to share some updates. We do have the member vaccine incentive program as well. Throughout the remainder of 2021, members will receive a $50 gift card per vaccine. So we've been able to work with several providers thus far to hold COVID clinics. We're also interested with anyone who would like to partner going forward. We're very interested in having those conversations as well. We were at the state fair, partnered with those folks there. And I do have a flyer that I'm happy to send out to the folks on this call that outlines all of that. Our incentive program is outlined on our website, and the information was sent out to our members. We also have shared our value-added benefits, and I have a flyer for that as well. It's on our website. It's on the member side and the provider side, both in the manuals and the handbooks. But I did want to spotlight a couple of our SCI. I know a lot of folks here work with our SCI members. So some of the benefits, added value benefits that we share with those folks. The kiddos get a duffel bag program where anyone who's moving homes, they get a duffel bag filled with personal items, blankets and hygiene items, things like that. And that's been a big success. And then we also have a birthday in a box where we send a kiddo who is celebrating their birthday. And we've got great feedback from that as well. So again, I have a flyer that outlines all of these. They're also on our website. So I'm happy to send that out as well. And I think that's it for today.
Okay, thank you, Joanne. And Humana Healthy Horizons, who will be speaking for them today?
This is Kathy Stevens. I can speak, give you an update. We too were very happy to participate in the Kentucky State Fair Health Pavilion as a collaboration with the Kentucky Association of Health Plans and in giving vaccines. And we are also continuing to educate and work to increase awareness and increase the vaccination numbers in Kentucky. We too have the member vaccination healthy rewards incentives, provider vaccination reimbursements, and are trying hard to provide vaccination analytics with our providers to support their outreach to patients as well. And that's all I have for today.
Thank you so much, Kathy.
Thank you so much.
All right, who will be speaking on behalf of Passport Health Plan by Molina?
Hi, this is Shelley Fife. I'm a provider service rep with Molina. I just wanted to go over some of our updates that we just sent out in our third quarter newsletter. We've joined the Psych Hub Coalition. In doing so, this is how providers and members can access mental well-being resource hubs. That way it's very direct and gets them going in the right direction. We also go over the benefits of prescribing naloxone to patients using opioid pain medications, just in case, something terrible could happen at home. There's an overdose, the naloxone is there. The quicker they get it, the better likelihood that they are to not have existing or ongoing issues with it. We also have live links to the cultural competency resources. And we're also offering a training seminar to help build cultural competency in the offices. We provide some vaccination tips for the 2021-22 flu season. There's also a list of screening services and care components for the EPSDT well child visits. We recently released a 7-week series called Cooking Fresh for Health for physicians to share with patients with diabetes, pre-diabetes, or just want to eat healthier. Also, we still have our ongoing COVID vaccine incentives. I'm hoping to be able to provide some more better numbers on the next TAC meeting, just to see how great that is going. Those are all of my updates for today.
Okay, Mr. Hewlin said last time that that you all were going to be paying incentives also for your members to become vaccinated. Can you speak a little bit more how that's working out for you?
I don't have numbers to be able to present, but I do know that it is ongoing. We've sent out email blasts to all of our providers, helping them educate our members on how to get that incentive. And it's also listed on our website on the member side and on the provider side.
Okay, thank you for your report. United Healthcare, Dr. Jeb Tickman spoke last time.
Hi there, this is Dr. Divya Canner. I'm the interim CMO. Dr. Teichman retired and he literally is laying on a beach. So we are so happy for him, but I'm here representing United Healthcare, and we also were at the state fair and really pleased to be a part of that and participated in increasing those vaccinations. I heard that through the KHP, we vaccinated all of the MCOs, and through the providers that were there, 550 vaccinations were given over the course of the state fair. That was excellent. United Healthcare is also providing gift cards to our members to incentivize them at $100 if they receive both doses by the end of this year. It comes as a form of a Walmart or CVS gift card. And we continue to educate providers, various organizations, CBOs, faith-based organizations, and really a multi-pronged approach towards improving vaccination rates throughout our state. The other aspect, another point altogether different, is I'd like to bring up that we are implementing an auto approval tool for providers for the prior auth services. So things that require prior auth, like say a knee replacement. It's an auto approval tool that's been implemented within UHC for other lines of business, commercial Medicare, for a couple years. And we're able to implement that now for our Medicaid providers. So when the provider or their staff input this information on their portal, depending upon how that information is received through an algorithm type of system, it allows for an approval to be given right then and there. So the process can become faster for our providers. If it will not give a denial, if it says it pens, that means that it needs to go through the usual channels of review. But certainly the faster acknowledgement of an approval is there. And since many of our providers in Kentucky have already been using this for a couple of years, we're hoping for a a good implementation process. So that auto approval tool is being turned on. Wanted to bring that to the awareness of this committee. And that's it. Any questions?
Thank you, Dr. Cantor. Especially talking about the auto approval tool. Last meeting, we had a discussion concerning just how much prior authorizations and, for that matter, referrals required in manpower and demands upon on us, and anything that can improve that is wonderful news.
Well, good. If there are any questions, I'm sure you all will come to us and ask, but we're hoping to be able to use computers so that we can all work smarter.
Okay, perhaps you can provide us a link or something to direct us.
Sure, absolutely. Thank you.
Thank you so much. All right.
Mike?
Yes.
Excuse me, this is Lee Geis from Medicaid.
Hi, Lee, how are you?
I'm doing well, thank you. I hope you are as well. I just wanted to bring up that open enrollment is coming beginning in November. No, October 15th. And running to the 1st of December. You may hear something about that, and you also may get a few earlier questions about open enrollment in your clinics from your patients. We had a few letters that were inadvertently mailed a little bit early. They do have the correct dates on them. They were just mailed earlier. So some folks may be already asking about open enrollment, but it still doesn't start until October 15th.
Okay.
Thank you, Angie. Sorry.
Very timely. Thank you.
Okay. The letters are supposed to be mailed September 10th or 11th. So they should be going out end of next week.
All right. Next item is recommendations to the MAC. Is there any recommendations to be made? No recommendations at this time. Next item is confirmation of the chair to attend the MAC meeting. The agenda erroneously says July the 22nd, and I cannot attend a meeting that's already taken place, but I am available to attend the MAC meeting scheduled for September the 23rd of this year. And then we'll go to F, new items for discussion. It's good that you're on here, Commissioner Lee. The last time we talked about the presumption eligibility period, and I wanted to ask at this time if you know whether or not that will continue for the calendar year 2022.
Is Commissioner Lee on?
I was unaware that she was on. You want me to respond to that?
I think he might have meant you, Lee.
Oh,
Okay.
But you do the PEs.
Right. So our current PE program will remain in place as long as the public health emergency remains in place. And that public health emergency is under the purview of the federal Health and Human Services Secretary. I have no reason to believe that it will end before the end of this year, but that is certainly all I can speak to right now.
All right. Thank you, Ms. Gass.
You're welcome.
All right. Takes us down to, well, let me ask, is there anyone else that have new items they want to bring up for discussion at this time? All right, there being none, the next meeting is scheduled for November the 4th at 10 a.m. And is set for the bracket of 10 a.m. to 12:30. That being said, that moves us to item number 6, which is adjournment. And is there a motion?
Chris? I'll make that.
Okay. Dr. Hagan has made the motion. I did not get who did the second.
Chris.
Chris Kaiser second that. All those in favor say aye.
Aye.
Okay. Thank you all so much for your time today. And if there's anything I can do for you on a personal or professional level, please let me know. Have a good day.
Thank you all. Have a great day.
Thanks, everyone.